Morning. Obviously, exciting time. We're having one of our first press conferences here in our new space at the Capitol. Capitol is beautiful. But more importantly, we want to talk about what it means to have Republicans in control of the legislature. We're going to move very quickly on legislation to help Minnesotans out. What we learned in the last election is that the number one issue that Minnesotans care about right now is the health insurance crisis that Minnesotans are facing. So we're going to talk today about the first part of that solution, which is going to be putting some help in the hands of Minnesotans, and also some small reforms helping them with access and other things. And our chairs will talk about that. But we're going to move fairly quickly to get this bill passed and on the governor's desk and this help in the hands of Minnesotans. So, Senator Gazelka.
Yeah, good morning. Just briefly, I can tell you that the House and Senate are on the same page. We may not move at the exact same pace, but we know that this is very important for Minnesota, that we give some emergency aid right now. And we really want to get some reforms going right now as well. But like the Speaker said, we want to make sure that the people that are in charge of this in our committees are really speaking to you and letting Minnesota what we want to do. Senator Benson, do you want to start?
Hi, Senator Michelle Benson. It is my honor to be the author of Senate File 1. I have been working on health care since my first day as a freshman, and this is a big deal that we are moving forward. We're starting to unwind some of what has been done to the state of Minnesota through the passage of the ACA and the full implementation of the ACA here in Minnesota. This is the beginning. There is much work to do. We are going to move expeditiously, but we're going to have a transparent process so that those who are impacted can engage at the legislature as they should. The House is going to move a little bit faster. We're going to have some committee hearings next week so that those who are impacted by this legislation get an opportunity to come forward. And then when we go to conference committee, all the ideas will come together. We'll pass this in a timely manner and get it to the governor. We are offering premium relief. We are helping those people who have acute health care conditions to have access, to continue to have access to their doctors. And we're doing some reforms that send a signal to employers and small businesses that they are going to have options in the new year so that they can help take care of their employees. Small business owners want to help their employees buy health insurance, and it has been cost prohibitive, and there are some reforms in this bill that are going to help that happen. We have some provisions in here for surprise billing. So as consumers are faced with healthcare choices and narrow networks, at least they won't be surprised by accessing a provider who might not be in network. These are all very good things for the people of Minnesota, but again, it is just the beginning. And I'm happy to work with Representative Hoppe and the entire team at the House. I'll let Representative Hoppe speak for a moment, and then we'll take questions.
Thank you. I am Joe Hoppe. I'm the House author of this legislation. We started working on this on a bipartisan, bicameral basis, senators, representatives, Democrats, Republicans, and most importantly, our staff, partisan and nonpartisan staff, before the election. We didn't know how the election, no one knew how it was going to turn out. This is an important issue, and I think everybody recognizes that. The Speaker and the Majority Leader meeting with the Governor the other day, I think was after the Governor had his press conference on Tuesday, I think it was Tuesday. I think that's a really good step. We are probably going to move at slightly different speeds than the Senate, but we are going to make sure that all members get a chance to be heard. We're going to be talking about MNsure and healthcare and health insurance a lot this session, lots of different potential reforms coming up. I look forward to working with everybody that's going to be involved, people from the administration, House, Senate, everybody. So with that, I think we can take questions. If there aren't any questions, then have a good day.
Has Governor Dayton signed off on this at all or participated at all in the negotiations, or are you planning to pass this and then see what he does with it?
Well, and the governor is welcome to engage in this process at any point. We'll be having hearings, and he is welcome to bring forward his reform ideas. The governor had a healthcare financing task force. Many of the ideas that we're going to discuss in the months to come were presented in that healthcare financing task force. So reforms have been talked about for a long time. The premium relief is the governor's priority, but I think most reasonable Minnesotans would say if you're going to spend $300 million, you should make some changes in the underlying problem. And so that's what we're going to work on starting today.
Speak to that as well. I do want to say, too, that Senator Gazelka and I met with the governor on Tuesday, the first day of session in the afternoon. I'm not sure that was widely known, but we talked to the governor about our idea of moving these bills quickly, and also our concern for wanting a very transparent process. So the way that this will work is the bill will pass the House first, then it will pass the Senate. We're going to put the bill into conference committee, so it's going to pass slightly differently in each body. And that transparent process of the conference committee is where we want the governor to be engaged in the process. He did agree with that process and buy into that process, so we're looking forward to having an open and transparent process in an open committee hearing in a conference committee where the governor and his commissioners are engaged in the process. So yes, he is on board.
You know, if I can add one thing to that, to answer your question specifically, has he agreed to all of these reforms? I would say the answer is not exactly yes, but I would say that he is agreeable to reforms, and I think that's important to note. And so we're looking at what are the things that we can pass right away, right now, and then what are the things that we have to do later. And that's not an easy task, but that's why we're going to have a conference committee and invite the governor in. We'll continue to invite the governor in.
Mr. Majority Leader, you were saying that you're not going to move at the same pace as the House. Can you be more specific? When are you planning to act? What will be the pace in the Senate versus the House?
Yeah, thank you. So in the Senate, we want to have a couple of hearings, both in commerce and health. And because of that, that's going to take a little more time. I still think
When will those hearings
as early next week, and maybe even tomorrow. We haven't decided 100% on that. But it all depends on how Senator Bach and I work together. But both Senator Bach and I agree that this needs to move at a fast pace. I still think that we can get this moving forward within about 2 weeks. So that we can work with the governor. We all recognize that this is a crisis, providing that relief. We agree that that's important. It's just important that we get some of those reforms as well. And so I don't want him to do anything to slow down the process, and we want to make sure that the governor is coming in and working with us. We know that for it to happen, we have to have agreement with the governor, and we intend to have that.
Someone talk about the structure of the premium aid. It looks like there's income limitations, and is it a monthly check that people will get, or how will that be?
For the first portion of the aid, it will be anyone who has an individual plan that doesn't receive premium subsidies through the exchange. And then we're asking MMB to work with revenue to do means testing so that we can stretch these dollars and impact the people who are hurt the most. There's a provision they can ask for direct deposit to their bank account, but it would be MMB issuing checks to those people to give them premium relief. We just think it makes more sense for MMB and there's an audit provision so we can match with revenue. The plans shouldn't have to be responsible for means testing their customers. I think it's more appropriate for the state to do that.
Looks like the funding source in Senate File 1 is money from the general fund that's headed for the budgetary reserve account. Is that an olive branch to the governor?
That has always been my preference. It hasn't been everybody's preference, but we'll work with it. We'll be happy to work with the governor on an appropriate funding source and get general agreement in the legislature where these funds should come from. People are very willing to help in a crisis, and I think this is an appropriate definition of a crisis.
I'd add one thing to that. We call it the rainy day fund. For a lot of people in Minnesota, it's raining.
This was the governor's original plan to take it from the reserves. That's what he proposed. So we're actually meeting him on this position, and you know, we think in the current circumstances that makes sense. So we hope the governor appreciates that we've taken his position on that.
And on the transition of care thing, it's $15 million. Is that basically to pay out-of-network costs for anyone who would continue to see their current provider and it's not covered by their plan?
It's not about a preferred provider. It is actually pulled from the continuity of care statute. So it is about people who are in acute conditions, people who are in pregnancy and are losing their doctor, people who are in their last 6 months of life and are in critical care. And so we're really focused on those people who are most impacted by a change in health provider.
I'll add one thing. I would say the plans also recognize that, and I think all of the parties here want to work on this issue, including the plans, and I think they understand that, you know, we don't want to leave people that are, through no fault of their own, all of a sudden without their local provider or somebody who's no longer in their network. So I think we'll get that figured out sometime in the next couple of weeks as we go to conference here.
Senator Gazelka, among the things that the governor was not exactly on board with was the income threshold, one of the things that he does not favor?
Well, that's why it's the House, the Senate, and the governor. We work to a conclusion. Our goal, we think we have good ideas, and we think they're good for Minnesota. And my hope is that we can bring the governor to our position. It's our job to convince him, both the House and Senate, and we intend to do that.
That was one thing, though, that he did not agree with.
Oh, well, there's a number of things that he hasn't agreed with yet. The other one that's really important to me is reinsurance, that we figure out a way to spread that risk across a farther group of people than just Minsure. At this point, he's not agreeable on that either, but we have to do have some conversations to convince him.
Just in brief about that, I was in many private meetings before the election, and I'm happy this is moving forward. But to the means testing at all, the reason it was so simple in the original governor's plan was for expediency and ease of timing. And so I believe this is an improvement. I think the governor may appreciate that as well.
I noticed one very small section in the bill makes a potentially big change, that it removes the requirement in Minnesota law that HMOs be nonprofits. Could someone address that?
I'll talk about that, and that's, I don't think that's anything we've discussed with the governor, but we're going to look at a lot of different things. And we don't know, none of us know, nobody knows what the healthcare marketplace is going to look like next year. There's a difference between healthcare and health insurance. Whatever we do, we're going to do based on the information we have and the laws that we have right now. Washington could change a lot of that. They might do nothing. They might completely remove the Affordable Care Act. We don't know. But we're looking at all the options that we can. And whatever else we say about the individual insurance market next year, or any health insurance market, it's not going to be the same. And if we can look at ways to, maybe we've never looked at that before, I think it's a whole new era in Minnesota and across the country. And there are going to be a lot of things that we look at that have never been considered in the past. So when we're looking at this globally, when we're looking at this issue, people say that it's a lot of money and that we're helping people with premiums, and we want to make sure that that's not going forward. Our goal here is to make sure that we're having to spend some money now, but our goal is to try to rescue the individual insurance market for next year and for into the future.
Can someone specifically address why removing that nonprofit requirement may be a good idea moving forward?
If you look at what's gone on, there's been fewer and fewer choices available. Some people have literally one choice, and it's not at all suitable for them. And so this is one way to bring in more options. We have the largest healthcare company in the country, and they're not allowed to deliver a product here. And so this, amongst other areas, are places you'll be seeing where we're trying to bring in more choices for more people, helping small businesses band together to buy their own plans through co-ops, and there's some of that in the bill. So people need choices, we need competition, and we think this will make a big difference for 2018, which is what we're looking toward.
But it's a fight. The nonprofit healthcare.
It shouldn't be.
We'll fight this, won't they, in Minnesota?
And again, we're going to bring this publicly so that stakeholders can say, this is why it's a bad idea, this is why it's a good idea. But in the end, we all have to be working towards what's best for the people of Minnesota. How do they get more choice? How do they get more access? How do we give them different products than what's currently offered in the market? And anyone who wants to come to the table and help us work on that is welcome. And this is just sort of a signal that Minnesota is going to be open for different ideas, and we're going to have a good conversation about health reform for the months to come.
Is that a must-have, though?
We're not going to talk about must-haves just yet. Negotiating with the press is generally not a good idea. We're going to work through the committee process. There'll be disagreements on some issues between us and the governor, and we'll have a little tussle maybe between the House and the Senate as to what's going to move quickly and what's going to wait for further bills. But we're going to do this so that the public can be engaged.
Mr. Speaker, or Leader Pepin, did you say that you expect a vote on the House floor as soon as next week?
I think, we're going to move quickly. We obviously, because of the nature of the beginning of session, we had our kind of ceremonial day on Tuesday. Yesterday, was a day we spent kind of in a bipartisan fashion at One Minnesota. We're having our first kind of caucus of session right after this press conference, and we're going to talk about it there. If the caucus is comfortable, we could move actually as soon as today. We do have an agreement from House Democrats to suspend the rules and take the bill up quickly. We have negotiated that already with them, and we have that agreement in place. Or it could happen early next week. So we're going to remain flexible and make sure that the members are comfortable with the bill, although these are ideas that we've been talking about pretty consistently since late last year. So I think the concepts the members are comfortable with, but we certainly, and I think them knowing that the bill is going to conference committee and there will be an open and transparent process there as well, will provide some comfort to the members that there will be time to make adjustments to the bill before it comes back for final passage.
Is there a date on the calendar by which you think you must have this out of the
I had really made a commitment that I wanted to have this bill out of the House. My original was the first week of session. That becomes very difficult because we don't even do bill introductions until today, the first bill introductions, and it's just difficult to get a bill out the very first week. So I had revised that later to hopefully by the end of next week, and that is our commitment. We will have a bill off the House floor by the end of next week. My hope is it could be as soon as today, but it could be early next week as well. It's not. We want to remain flexible with the governor as well. We know that he's going to want to have input in this, and that was why we pitched to him that we wanted to put the bill in conference committee so that he could engage in that open and transparent process, and we certainly want to have his input. We want reforms in the bill that are going to make a difference and affect people who are impacted by this right now in 2017, but also kind of set the stage for 2018. The major pieces of this bill really are the premium relief and the access issue, the continuity of care. The other things are kind of smaller reform issues that really shouldn't be all that controversial, but we know that there will be discussion about those things. We want to remain flexible and certainly give the governor an opportunity to have input. But we're going to move as quickly as we can to get that relief in the hands of Minnesotans.
Senators had been pushing for a more robust pet bill that included reinsurance or something similar in this first package, and I noticed that it's not here. Was that just a logistical question about the speed, or talk about the reason why this doesn't have those things you were pushing for?
Well, as far as the reinsurance issue, it is more complicated. We totally get that. But we need to do something by March to let the plans know where we're at for 2018. And that's why I've been personally pushing it. But I also recognize that we want to pass some relief right away with some initial reforms that we all agree with. And so from our point of view, whatever we can get now is a good thing for the future. Because if we look down the road 2, 3, 4 months from now, it gets more complicated to pass a second bill or a third bill. And so, I want to get as much as we can on this first bill. And I appreciate that the House is moving quickly. I mean, the Speaker wanted to do it right away is important. It tells you that we consider this a very, very serious issue and something that we want to get done.
Mr. Leader, the options to increase consumer protections and so on and so forth, and this is a question for the Speaker as well, is that a requirement as far as their caucuses are concerned to move this bill off the floor? Is it beyond that, is it a requirement that Governor Dayton agree with that in order to move forward?
Well, in the Senate, that we have 34 Republicans and 33 Democrats, and so I don't know what it'll take to get it off the floor yet. All I can say is that we want as many reforms in there as we can, and then as we go to conference committee again, we'll be working with the governor to make our case that these are important to do right away, knowing that he may not agree. In the end, though, we do want relief, but we also, that aid that we're talking about, but we do want reform in the beginning as well.
Whatever you bring to ultimately discussions with the governor, if it comes to that, does it need to have those initial steps in it?
I won't say the initial reform steps that we have to close up the bill. And I think somebody else said it well here earlier about how we negotiate. But we do absolutely want some reforms, and not just the aid that we all agree with as well.
All right, thanks a lot.
Thank you.